Florida. Of the 19.8 million that called the state home in 2014, 6,019 contracted the HIV virus. The Florida Department of Health estimates that that year, an additional 1,100 might have also contracted the virus, but are unaware of it without a diagnosis.
In 2014, the third most populous state in the country had the most newly diagnosed HIV cases.
According to the Florida Department of Health, it is projected there are as many as 500 new cases of HIV contractions per month in Florida. That's 6,000 new cases per year. Additionally, according to the Florida Department of Health, based on a 5-year data trend, which shows an overall increase in cases of new contractions within Florida, there is a concern that the rates of new infection may continue to increase into 2016. Thanks to advances in testing accuracy, the reliability of data reporting, and better coordination of case management, the Florida Department of Health has not only in recent years been able to better serve those at risk in Florida, but has also made it easier to understand the status of the background of HIV. In 2014, 3 Florida counties, Orange, Broward, and Miami-Dade, accounted for over 50% of newly diagnosed HIV contractions in Florida. We went to see firsthand how drug use, poverty, and stigma are affecting those at risk and what's being done about HIV in Florida.
Despite increases in injection drug use since the 2011 anti-pill mill bill and the subsequent saturation of heroin to fill the void left behind by prescription narcotics, Florida is currently one of the 16 states in which syringe exchange programs are illegal.
So I'm Dave Wallace. I'm the Director of Public Policy at United Way of Broward County. In my role as Director of Public Policy, I've been working with our state legislator, Katie Edwards, who has been, for the last couple of years now, trying to push legislation around needle exchange programs. So she has introduced legislation this year. It's House Bill 81 that would be it's called the Infectious Disease Elimination Pilot. And it would be a program with University of Miami at Jackson around a needle exchange program and provide the context and the infrastructure for us to really get hard data on the impact that needle exchange programs have on reducing and eliminating the spread of infectious diseases, especially HIV/AIDS, and now we're seeing a huge rise in South Florida in Hep C.
Syringe exchange programs have notoriety that they encourage high-risk behavior and only treat a symptom instead of the problem. There are those who disagree.
My name is Carlos Franco. I'm in Miami, Florida.
Carlos Franco has been distributing clean needles for almost a decade. By providing counseling and clean medical equipment, Carlos has been fighting to reduce the risk of infectious disease for whom he sees as a marginalized group.
Syringes, you mean? Yeah, well, initially when the syringes were started to be provided to heroin addicts or heroin users, they were calling us enablers. You know, they were saying that we were enabling people from, for using drugs. You know, that we get them syringes, therefore they could use the drug. The fact is, they're going to use the drugs whether we're giving the syringes or not. We go.
In your experience, what are the dangers of criminalizing drug addicts and drug users?
Well, for one thing, I think we have talked about it. There's no, where's the victim? If you smoke, you possess anything from marijuana to heroin. Who's the victim there? Compared to, like, if I'm a murderer or I steal, I'm a robber, I rob from you or rob from somebody, you become a victim. But when somebody possesses a drug, where's the victim? Who is the person? And I always assume that to have a crime, you have to have a victim. But we have created this society as the victim, which is a delusion. So that's
again, it really is a serious public safety issue. So needle exchange programs, they get dirty needles off the street. These programs become an important gateway to people who are intravenous drug users to get the treatment and care that they need. And I just want to, reiterate too that why this is such an important public safety issue. We have studies from law enforcement in places like Baltimore and San Diego and New York City that have shown that many law enforcement officers get stuck with dirty needles, get pricked with dirty needles, that when those communities have put these programs in place, they've seen a dramatic reduction in law enforcement and other first responders being at risk for this. And that ends up getting, if they're getting pricked by dirty needles, then they too are become at risk for HIV and Hep C infections. So,
The Infectious Disease Elimination Act is slotted for the 2016 Florida Senate session. The fate of the bill will be decided this January.
While HIV doesn't discriminate and can infect anyone, according to the Florida Department of Health, some of the groups that are most affected by HIV in Florida include men who have sex with men, heterosexual black women, and the youth and the elderly. It has also been noticed that there are higher rates of HIV infection in metropolitan versus rural areas. The same is true for areas stricken by poverty. There is also an adverse and disproportionate impact of HIV on ethnic minority populations. For these reasons, we went to Paramore in Orlando to see what was being done.
Paramore, a nearly century-old historically black community and feature of Orlando, was the product of segregative efforts in 1928. The community of Paramore grew and flourished despite the harsh realities of stigma, oppressive housing conditions, and discrimination. We spoke with Commissioner Regina Hill, the Paramore Neighborhood City Council representative, about a plan which is intended to revitalize the neighborhood.
Of our staff and our team and the community, because they were a part of it, of putting this comprehensive plan together. So what I see is a bright future for cradle to career. Our babies that have just been born, our youth that are now in that pipeline, and our seniors. What I see is the days of old when folk always said the place to go is Paramore, because we have arts and culture and music and thriving businesses in a great neighborhood. So that's what I see the Paramore Comprehensive Plan doing, is navigating us back to the days of old, but a more progressive community in today's Orlando.
Contemporary Paramore has been seen by many as needing a plan like this. It is a situation where approximately 19% of homes or living spaces are vacant. As far as occupied homes, 73% of Paramore residents rent rather than own their homes. Life here is a far cry from adjacent downtown Orlando. The unemployment rate is 23%. 1 in 4 residents are unemployed, and those that aren't may not make enough to support their households alone. Average households are comprised of 2.7 people, and the median income for the area is $15,490. The Paramore Comprehensive Neighborhood Plan is the product of a federal grant awarded to the Department of Housing and Urban Development to the tune of $39 million, the goal of which is to target housing, economic and workforce development, and infrastructure investment to create more jobs and regional economic activity. The Paramore Comprehensive Neighborhood Plan includes not only a K-8 school and extensive infrastructure projects, but also the PKZ, or Paramore Kids Zone, which offers developmental and educational services for the community.
That's how we were able to produce 30 seniors and all 30 going to college. And we've seen the needle move by having that one-on-one. PKZ is not just a city center. It's actually a parent for the youth. Not a parent, but a family for the youth there in the Paramore area. Big brother, big sister organization.
Incidentally, Paramore will reap the benefits of an additional $1 billion of investments aside from the Paramore Comprehensive Neighborhood Plan. A downtown UCF and Valencia campus, a Major League Soccer stadium, and the I-4 Superhighway are all less than a few miles from the Paramore neighborhood. While education is the cornerstone of the Paramore Comprehensive Neighborhood Plan, these additional improvements will certainly make a big difference for the community. While the Paramore Comprehensive Neighborhood Plan wasn't intended solely to address HIV in the community, it will without a doubt have an impact on the neighborhood. Some final words. HIV doesn't discriminate. It can infect anyone. Know your risk factors and how to manage them. And in this case, taking care of yourself is taking care of the community.